Welcome to my 15-minute video on biomarkers from biosimulations. I am Clyde Felix. The primary focus on this is to demonstrate some results that I've generated by using NodeXL freeware to map pathway networks, and in this case cholesterol pathways in Alzheimer's disease and the aging human hippocampus. The technology used here is patent pending, called transcriptome to metabolome. Here we see we start with a transcriptome and we can end up with a metabolome. This is a trademarked technology by the spin-off company, the startup from the University of Texas at San Antonio, by myself and some other colleagues. You can visit my LinkedIn site to discover a bit more information there. Anyway, that company is Alpha Helix Biometrics Incorporated. And we see here the general scheme in a pictorial or illustrative sense. This is actually a cytoscape force-directed layout of the TTM, the complete one. Over here you can see the trifatty acid assembly. And in a metabolome you would get a level for all the metabolites in this. In the fluxome, you get a flux for every reaction or biological step, such as transport of pyruvate into the mitochondria by the mitochondrial pyruvate complex carrier, the MPC. If there is a model you're working with that has proteins included in it, you can get proteome as well. In this case here, this is apoptosis with the caspase 3 obviously acting on many molecules there. The workflow can be viewed in another sense. This technology can be applied to any living organism, archaea, bacteria, and eukarya, as long as they have, once you have a genome and a gene annotation sufficient to match whatever reactome or pathway you're interested in, and you can generate a transcriptome on that. This workflow starts basically where we have a particular model, in this case the TTM with metabolic pathways in it, and we have a gene list where genes are assigned to that. It's a very common practice to assign genes to reactions or biological steps. And then what we need to do is to start with transcriptomes from individual samples and match the value in the transcriptome result using the gene annotation table to the gene on our model list, and then put that value that we extract into the model. In our case, we use Kapasi as a simulation software. It's a freeware. After the simulation, you generate secondary data sets, the values for the levels and the fluxome for the flux of each reaction and biological step. So we use the terminology primary data set as the transcriptome sets coming in, and again we run one simulation for each individual sample for which a transcriptome was generated. Now if it's pooled samples, it represents that pool. This allows us to track in a longitudinal study individuals, so for paired comparisons or repeated measures, it's a very powerful technique. And for individualized medicine, we can see what's happening for each individual. Anyway, after the biosimulation, we generate these secondary data sets, and these can be analyzed as well as a little bit of the transcriptome, as you'll see from the mapping exercises in this presentation. So I have to start with a transcriptome. In this case, it's an Alzheimer's disease transcriptome, GSE 28146. And this is the CA1 area of the hippocampus, age match control, what they're calling incipient. Nowadays we probably would call mild cognitive impairment, MCI, and then moderate Alzheimer's disease and severe were the ones classified there. In this case, they have we're not seeing the severe ones here. It's off the screen anyway. When you get the full table, they would be on there. Not all the rows are showing, but anyway, you can see in this case we have the MMSE score for cognitive, and of course these are post-mortem samples, so the NFT pathology. This allows us to perform regression analyses, which is a very powerful testing, as you might know. In addition, if we're testing the effects of drugs within the in silico simulation for an individual, in this case on the right we see an individual human sample for bronchial epithelium, and in the lower one, periodontal ligament. And we're testing effects of dose of transforming growth factor beta 1 on the production of collagen 1, which is related to the thickening of the bronchioles in asthma, anyway, and repair of the periodontal ligament in periodontitis. Anyway, you can calculate the EC50s. You can see we're getting tissue specificity. So gene expression profiles differ for tissues. We would expect connective tissue to have a lower EC50 for the TGF beta 1 than we would an epithelial sample. Right? This is a brushing, I think, of the bronchial epithelium. Anyway, and then these are the summary data for the periodontal ligament, comparing healthy to periodontitis, so we can see that there's no difference in the EC50 for these. Slight shifting, but an N of 5 in each, and the slight difference that's there would not be enough to show a difference. But anyway, that's the power of this method. So whatever the source of information, analyzing the secondary data sets, potential candidates for biomarkers. So biomarkers from biosimulations, and of course in that, testing the efficacy of drugs and determining the appropriate dose of a drug for an individual patient. So the reactome is next. That's a little bit about the transcriptome and a deviation to other applications. But anyway, this is the human psych site. So I use this to type in to Kapasi the whole set of metabolic pathways that I'll show in you in a moment. This is the cholesterol one, starting with acetyl-CoA. You assign the gene or genes to the reactions. So no big deal there. And then this is the full cholesterol pathway, biosynthetic pathway that we have in there. And we're adding more and more to the homeostasis. The current model has some of the ABC transporters, carriers, and LDL and ApoE and things like that. So we're working on the full life cycle of a cholesterol molecule, if you will. And this is the full set of pathways. So the TTM model that I'm showing here doesn't have the TFA, the triacylglycerol, the TAG pathway. I removed those because for neurons, that's not such a major issue. Plus, it's a labor to do all that calculation. Anyway, here are the pathways, essentially 30 of them. There's 31 on the list, but I take the plasma steroids not so much as a pathway as it is just a mechanism for removal of the steroids, the neurosteroids, the full steroid synthesis down to neurosteroids within the brain tissue. Anyway, you can pause and take a moment to skim down through those. You can see full glucose, ketones, the cholesterol pathway, acetyl-CoA biosynthesis, fatty acid synthesis, and beta oxidation. We take the cholesterol all the way to the steroids, and then GAGs, fatty acid acylation, elongation, arachidonic acid. I guess I'm taking you through all of them. Phosphatidic acid and diacylglycerol. So the membrane lipids are important for neurons. We take it all the way to that level. Did I mention sphingolipid as we went along? Anyway, this is the grand scheme someday. You can't always wait until people die to do these determinations on postmortem tissue. So the idea is to collect some blood, do the transcriptome, send it off to the lab, right? And then we do the biosimulation, tracking the biomarkers, and then do the metabolic profile or whatever data goes to the clinician for clinical decision making. So medically actionable outcomes are what we're focused on. Another idea is, and it's already shown that this technique with this blotting paper preserves the RNA sufficiently from a droplet of blood. Send it to the person at home or wherever, doctor's office, wherever it is, collect it, ship it to the lab, boom, boom, and very efficient way of doing this. So at this point, at least the Affymetrix equipment, instruments, and the microarray chip and reagents are FDA approved for clinical trials and testing. So this can be done under CGLP and CLIA conditions. Just our part has to reach that point. So whether it's an LDT or FDA approved is up in the air. Excuse me. The data all has to be collected, of course. So this is the idea of the blood as a surrogate. Run the transcriptome, apply conversion factors, in this case pancreas, liver, skeletal muscle, adipose tissue, add nerve tissue for what we're thinking about here, sort the converted parameters for biosimulation in either the TTR, transcriptome to reactome, if it's a peptide like the glucose tolerance test that's shown here, a multi-organ system, or the TTM, glucose homeostasis metabolic profiling as the GHMP, and then you have the clinical utility. And of course, for research purposes, it's phenomenal. So let's take a moment to look at the cholesterol pathway. This is how I've got it set up in the Node Excel, which goes right into Excel. And as I said, it's free. You just have to have a licensed copy of Excel. We see the mevalonate pathway starting with coenzyme A and acetyl-CoA, progressing through the pre-squalene pathway. So there's mevalonate, then the pre-squalene pathway down to squalene. And after squalene, there's three pathways: cholesterol pathway 1, 2, and 3. Cholesterol pathway 1 is lanosterol to zymosterol. Pathway 2 is lanosterol to lathosterol, and here's cholesterol down here, showing a negative 85, so I'll explain those in a moment. And pathway 3 is the desmosterol pathway. So in fetal and early life, until myelination is completed, basically, the desmosterol pathway is prominent in neural tissue, and then subsequent to that, it shifts to pathway 2, the lanosterol lathosterol pathway. And pathway 1 is present as well. You can see DHCR24, which is siladin gene, thought to be involved in Alzheimer's disease. Many reactions that it's involved in, not merely the pathway 3 for desmosterol. So caution to those that are reductionists and linear thinkers. You have to think in an integrated network fashion. Anyway, for the Node Excel, I set it up where the size of the spheres and the color of the spheres indicate the levels. And so this brownish color in this size is the 0, and the green is decrease. Whoops, sorry. And you can see the arrows are labeled with the genes for the flux on the size of the arrow, and whether gene expression goes up or down as a percent shown there. So this is one way of showing those results in a 3D graph in Excel. So here's the metabolome with every metabolite. Here's the fluxome comparing incipient to everything back to control. So this said like this is just a quick screen. And then we can flip through these. I just have a couple minutes left of recording, so I'm going to go through them. You can stop the video and watch. So you can see the comparison, moderate to control. So first everything is to control. So look for red for increase. This is an increase of gene expression. The change in the size of the arrow, look at this one up here, is the percent change in flux for the comparison shown in the top right. So I also compared so that's severe to control. Here's moderate to incipient. So each stage back to the prior one, which isn't very commonly performed. Note this molecule here, farnesyl pyrophosphate is what that is. So here's the aging study. See that FPP light up. So here we're comparing everything back to the youngest age, and then each to the prior set of decades, and the 80 to 99 to the 40 to 59. And just a few moments left here. So in the end, we follow FDA requirements for clinical validation of prognostic biomarkers of risk and predictive biomarkers of drug efficacy and safety, and follow their statistical guidance on reporting results from studies evaluating diagnostic tests. So there's no question about what needs to be done once you've got your biomarker. that's our 15 minutes, and I hope you enjoyed my presentation. Thank you for joining me.